The IT band is a continuation of the tensor fascia lata that originates from the anterior superior iliac spine and inserts into the deep fascia of the IT band. The IT band then continues distally to insert at the anterior tibial condyle. The IT band can become irritated or damaged by excessive friction of the IT band on the distal femoral condyle. Clients with iliotibial band syndrome often present with a history of having participated in repetitive use activities like running, cycling, swimming, climbing, sitting, and squatting. A lot of times they complain of stabbing or stinging pain along the outside of the knee and snapping over the knee as it transitions from flexion into extension. Edema can also be present at the knee in response to excessive friction and irritation. Adhesions typically develop throughout the IT band, especially near the distal attachments, with compensatory adhesions developing in the quads, adductors, hamstrings, and gastroc muscles. Localized friction and trigger point releases in and around the IT band help to reduce adhesions and pain. The idea with any cupping treatment is to lift, separate, stretch, and create space for things to move smoothly and freely. The IT band is no exception and can be particularly tight and troublesome over the greater trochanter of the hip and just lateral to the knee at the lateral femoral condyle. We're going to load the IT band and its adhesions or stuck areas with plunger cups. I'm going to start with the big cup for the larger area. As we go down toward the knee, we can kind of switch if we need to, and we can do a smaller suction cup. I'm going to start about right here because we did our assessment and I found a tight area or adhesion here. So I'm going to start here. You're going to start anywhere where you feel tightness or you feel adhesions. So we're going to place the dome of the cup right down on the skin. Press the edges down to flip the cup back inside out. And again, you see how much movement we get from our client using that suction method. So I'm going to load her up. We're going to put that last one right over the kind of lateral knee area. And then we're going to do what I call the monkey bar technique. So we're going to start superiorly, and I'm going to literally just lift up on the handle. When you're doing it, you should actually feel that lift and separation of the skin and of the soft tissue. So I'm going to lift up, and I'm going to hold. Anybody that has pain here, that has compression, you're going to immediately get, oh my goodness, that is amazing. So we're going to lift and hold. I like to do it about 15 seconds. Talk to them, check in with them, make sure they're doing okay, maybe talk a little bit about food and what they had for their birthday meal. Then you're going to go to that next cup. Same thing. We're going to lift up on that next cup. So it's literally like we're swinging from one cup to the next while gently pulling up on the cup and holding for 5 to 10 seconds with each cup. The handle on the grips cups makes it perfect for lifting and holding and swinging to the next cup. You can also use an edge cup or a Zen cup for this technique. If you have those, we can work forward, we can work backward. So I can start here and I can go all the way down to the knee, again, lifting and holding about 10 seconds. And I'm just swinging up and back, and then I can reverse that direction. We can add a little bit of movement if we wanted to. So in addition to just decompressing that, I can actually move that cup in circles, almost like stirring the pot. So we can stir the pot here. We can slide down distally to the next cup, and we can do the same thing there. I can make the cups go in different directions. We can do whatever we want, but that monkey bar technique is what I really, really like to do from here. Another way I like to treat the IT band is using an edge cup to perform dynamic friction over areas that are typically troublemakers, again, like the greater trochanter and the lateral femoral condyle. With this technique, we are literally just going to go through and vacuum out any adhesions that we found during our assessment. So I like to use the pinch grip method. I'm going to pinch grip. Usually there are a lot of adhesions kind of distally on that IT band. So we're going to pinch grip. I'm going to keep it in a bit of an oval shape, and I'm just going to friction or iron out adhesions in that IT band. I can work my way up from distal to proximal, and I'm going to go perpendicular across the IT band. Again, nice and slow. A faster rhythm is usually more painful and more shear to the tissues. I can kind of brace some of the tissues so I don't get excessive movement if I don't want it. So I typically do brace proximally and then just friction my way up that IT band. If I find a spot that I feel like it needs some TLC, I can park the cup there. I can reach into my handy toolbox and I can get another edge cup, and then I can continue my way proximally up that IT band. If the cup breaks suction, doesn't matter. Put the suction right back on, another pinch grip, and go right back to it. The third way the IT band can be treated is to apply the cups statically over the lateral leg, which we've already done. I've used some of the big grip cups, and I've used a couple of the small cups too. While the cups are statically in this area, we are going to simultaneously stretch the IT band. You want to make sure that your client doesn't have any back or hip issues before getting them into this position, because there is a little bit of torque and mild stress that can occur at the back and the hips with this one. Whichever leg you want to be treated should be on top. You're going to apply the cups, as we already have, on the lateral side of the leg, while the client is in the sideline position. Next, we're going to have them scoot all the way to the back of the table or the edge of the table, and we are going to slowly assist them into extension and adduction of their top leg toward the floor. So we're going to take the top leg and we are going to extend that leg. I'm going to brace her back so that we don't get a lot of rotation. I'm going to extend that leg and then adduct, ADD, her leg down toward the floor. We can hold this stretch for 15 seconds or so, then bring the leg back up into the neutral and resting position, just to allow her back, her hip, and those tissues a little break from stretching. We're going to rinse and repeat. We're going to do this about 5 more times. Or if your client can handle a longer stretch and you would rather just do longer stretches with fewer reps, you are welcome to do that as well. Whatever resonates with you and your practice. To kick that same IT band stretch up a notch, again, while we have her leg extended and adducted, we can take a cup and we can friction over any areas that were tight or that had adhesions. So we're going to maintain our client in that stretch position and dynamically friction out adhesions while keeping them elongated as much as possible. This is more intense than the stretch with just the static cups, so make sure your client can handle it and make sure you are skilled enough to perform the friction and support the stretch all at the same time.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.